everybody. This is Dr. Batra and a pediatrician at Marshall County Pediatric Physicians. I'm here to answer some of your questions. I have a few questions which were asked on Facebook, and I'm going to go through the questions one by one. So let's see what we have. The first question which I often get asked is, how often should my child see the pediatrician? Okay, I would say think of your pediatrician as somebody who is like your partner in taking care of your health, in taking care of your child's health and well-being. Okay, a pediatrician's role is very important to make sure that your child's development is on track. Okay, and that for that, make sure you make wellness appointments with the pediatrician. Okay, the recommendation by the CDC and the American Academy is there should be 7 well visits from the ages newborn until 1 year of age. Okay, so that means a child should see the pediatrician every 2 months, every 3 months during the first year of their life. Okay, and the purpose of that visit is to make sure that the growth of the kid is okay, the development is on track. Okay, a child is doing what he's supposed to do. So developmental monitoring is the main objective of these visits from newborn until 1 year of age. And after 1 year of age, the CDC and the American Academy again recommends about, let's say, 7 visits from the ages 1 to 4 years of age. And after 4, it's one time a year for an annual checkup. Okay, and not just the regular visits, a child should see the pediatrician to identify the current health problems or answer any questions parents have and to develop that relationship with the pediatrician. Okay, so let's say the second question we have is, my teenage son wants to weight train, should I let him? Okay, so that's a very good question. I would say the recommendation is weight training or 3 times a week or more. But again, the most important or one of the important factor in this question is the age. Is your child age appropriate to participate in the strength training program? Okay, age requirement means, is your child, can he focus enough to understand all the instructions that are given by the coach and follow through the instructions? Okay, and the second thing is, strength training is great. It is good for your muscle building as well as your bone density, but you have to have a good, responsible, mature coach. And the strength training program has to be supervised. Okay, just to make sure the load is good, the repetitions are right, it is customized according to the child's need. Okay, so that's very important. Okay, now the next question I have is, my baby's hands and feet are always cold. Is that a problem? Okay, all right. That's a question that I have been asked so many times. Okay, and I would say it is perfectly normal for the kids to have cold hands and feet. And the reason is, when the baby comes out of a mom, their circulatory system is not developed. It takes few months for the circulation system to develop, and the hands and the feet are the organs which are the end of the body which get the blood supply the least. So the hands and the feet are always cold. One thing you should do is, if your child's hands and the feet are cold, is to put the hand on the chest and the belly and the back. If the torso or the chest and the back is warm and pink, nothing to worry about. You don't have to increase the heat on the thermostat. You don't have to give an extra blanket. Just make sure the torso or the chest and the belly portion is warm and pink, and that is totally fine. Okay, give it some time, give it a few months. It will get better with age. Okay, all right. So the last question I have is, when should I keep my child home sick from school? Okay, that's an excellent question, and that's again asked very frequently. Now the general rule is, or the three things I would say in brief. First thing is the age. First thing is the fever. Okay, in younger kids, fever of 100.4 or more is called a fever, and in older kids it's more than 101. If your child has a fever, it is generally a sign of sickness, and the best is to stay at home until the kid is fever free for good 24 hours without any Tylenol, without any ibuprofen. So fever free for 24 hours. Okay, that is the one thing. Second thing which can help parents decide, should I send my children to school or not, is the child well enough to participate in the physical activities? nice, or is the child well enough to sit in the class and focus and listen to the teachers? Okay, if the child has been coughing all night, he's tired, he's achy, you don't want to send them to school. But if the child is having cough congestion and he's running around, of course he can go back to school. The other thing is, how long are the symptoms been there? So usually vomiting, diarrhea, if it's fever or strep throat, or even if it's pink eye, usually you want to make sure that the child is on treatment for 24 hours before going back to the school or the daycare. So 24-hour is the general rule. Okay, so kids should not have any vomiting or diarrhea without any medicine for 24 hours, and then they can go back to the school so that they are not contagious to other kids. And same rule applies for fever or pink eye or strep throat or those things. Okay, thank you for all the questions, and I hope the answers you find useful. Okay, I'm here at Marshall County Pediatrics, and if you have any concerns, questions, you can call the office anytime. I would love to see your child in the near future. So call the office if you have any questions.